to the show. The show is Your World, and we are in the second hour of the conversation. Time really flies when you're having impactful conversations. And like I said, on this hour, we'll be focusing on cancer, World Cancer Day. And since it is Relationship Tuesday, then we want to understand how, first of all, getting such news, having to deal with your partner, the person that you love the most, but seeing them going through what they're going through, what impact can that have on a relationship, but also how do you come out stronger together? All right, so that is the conversation that we'll be focusing on today on World Cancer Day. But before I introduce my guests, let me just take you through some a bit of the numbers and statistics. So according to the World Health Organization, in 2022 they reported that there were nearly 20 million new cases of cancer and almost 10 million deaths globally. And the most common in terms of the new cases of cancer were breast cancer at 2.26 million, lung cancer at 2.1 million, colon and rectum at 1.93 million, prostate at 1.41 million, skin, that is melanoma at 1.2 million, and stomach cancer at 1.09 million. The most common causes of cancer deaths in 2020 were lung cancer at 1.80 million deaths, colon and rectum at 916,000 deaths, liver 830,000 deaths, stomach at 769,000 deaths, and breast at 685,000 deaths. Now, we have a new theme that will run from 2025 all the way to 2027, and the theme is United by Unique Places, People at the Center of Care, and their stories at the heart of the conversation. And that is exactly what we are doing today, having people be the center of the conversation right here on Relationship Tuesday. And I have on my immediate right is Linda Njoki Mwaura Nyumu, who is here to share her story with us and encouraging as many of us who are watching this morning. Thank you so much, Linda, for coming.
Thank you.
How are you?
I'm fine.
You look beautiful.
Thank you.
Look at your outfit. Clearly, there's a memo. Leo nilipata memo.
Yeah.
We say thank you.
Thank you
so much for coming by today to share your story with us. And we also have her husband, that is Felix Nyumu Matiso, here as well to, talk on, and especially the role that caregivers, partners, people, around us in terms of support, what exactly that looks like. So thank you so much.
Good to be here.
For
thank
coming.
You so much.
Let me tell you, I look at you and I'm like, mapenzi wewe. Do you know why? Because they're like, you see the way we're seated, then they're like, kwa nini kuna gap? It's like we have separated them.
It's been this way ever since we met.
Right?
So this is too much gap.
This is too much gap.
This is too much gap.
Cancer
Even
can
the
give us
kids.
this first.
Please forgive us. Please forgive us just for now. But can we go back, right? When did you guys meet? Before we even talk about diagnosis and all, because you have a very beautiful story, both of you. Can we just talk about how you guys met? There's so much love here that I feel lonely. I'm like, okay, anyway, it is okay. Can we go way back?
The Lord remember you.
Please,
Amen.
at this point.
Amen.
There's this friend of mine, Bernard Akasa, and by then with his fiancée, they were planning a wedding. So she was a friend to the fiancée, the bride.
Okay.
And I was a friend to none of them, but I was invited by the sister to the bride of the wedding. So they were planning their meeting, and I was there. There was this WhatsApp group that was put together just to prepare the wedding.
Okay.
And I felt like this budget was too much.
Yes.
And we need money more than these things. So I looked for the secretary's number to say, I can help reduce this budget, but still have a very wonderful wedding.
Okay.
So I started chatting the secretary in the name of reducing the budget. So the first time I attended the meeting, she was not there. I was there. The second time, she was there. I was
You
not
were
there.
not there.
The third meeting, we were both there.
Okay.
And after the meeting, here and there, we have the meeting, and people are leaving. I exit the venue of the meeting. When somebody called me back to the room, and I saw this wonderful lady. I'm like, wow, this is it. This is the one.
Umepata kipenzi cha roho, the rib.
See, you're putting it mapenzi wewe. Mapenzi slapped me nicely. And that's been the story to this moment.
Yes.
Full of, it's a very short, long story. And I thank God for Linda. I thank God for everything about her. She's a wonderful lady. I hope I'm a wonderful man to her.
Yes.
He is.
Yeah?
Yeah.
Apezi slapped you on the first sight.
Not immediately.
Not immediately.
Because I was the secretary. And before you go to the table, we had sat next to each other.
Okay.
But then now he was eating tropicals.
She's never accused me of that. It's okay.
He was eating tropicals.
Yeah.
Me, I'm used to, even when you're having tropicals, you share.
Yes.
But him, he was feeling unwell. So yeah, naona najifungwa ko. Me, from that time, I just ignored it. So when he says our eyes locked and all, I'm like,
yes,
that was God doing.
Right.
But if it was for me to look, I would have missed my opportunity.
Right?
Yeah.
Oh,
but
my
I thank
days.
God that he didn't stop from there.
He opened your eyes eventually.
Yes.
And you saw. And you saw a good thing.
And I saw a
Winnie,
good thing.
From that day, it was May of 2016.
Yeah.
2018.
Yes.
No, May we dated. 2017 I had done we done the Rush show.
Hiya.
It was what was that? We loved each other and we did everything we could do.
Yes.
By when did we do our wedding?
2017.
April 8th. She was my wife.
Yes.
We met on the 2016 May.
Eh.
And it was awesome. It was a blessing. It was a big deal.
But he officially asked me to be his girlfriend in June.
In June.
Of 2016.
By
By the first week of December, he had already paid my bride price. By April, we were already married. By June, July, nilikuwa natapika.
Oh my gosh. The baby was already on the way.
But I thank God for that rushing, because God knew where we were heading.
Yes, and the reason why you're here today.
Yes,
Oh my gosh, it's such a beautiful story to hear. Hey, mapenzi wewe. Listen, a reminder of where we are today. We are at Karibu Inn, and like I said, if you're looking for that beautiful space to host, your event, Valentine is coming, okay? And you're looking for a place to take your loved one. Karibu Inn has all those facilities. They also even have a kissing booth, okay, for you, so you know what you're getting yourself into. Now, so met, everything was beautiful. Firstborn came. Right? Let's talk about that point where you got the news. And even before you got the news, what happened?
Firstborn came.
Tukalea. Yes.
Then tukapata another, I'm all of a sudden sick. I don't know why am I sick and all that stuff. I'm having my period. So I'm not thinking I'm pregnant.
Okay.
So the firstborn is barely, hata jafika 2 years. I find myself pregnant.
Okay.
Then I'm told you're about 9-10 weeks pregnant.
Give strong.
Give strong. Now the second born, it went well. Akakuja, it was such a blessing.
Yes.
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 Then I'm now breastfeeding him. It's now 3 months in. That time, I used to have a lot of milk. It just came in. My friends used to enjoy me really fresh.
Yeah.
So it used to come in. So every time I'll go to the hospital, see my gyna, they'll tell me it's mastitis because I'm having lumps. So my like a morning, to make you understand what I mean, I had a lot of milk. My morning pump will be almost 2 liters of milk.
Where?
It was a lot.
Wow.
So you'll think I'm pumping, I'm draining it, so I'm still having lumps. So every time I go to hospital, I'm told it's mastitis. It reached a point I got tired of it. Because you're given antibiotics, you're given a cream to apply and such. I said, no, I need a better opinion.
Yes.
So we went to a Nairobi hospital here in Kenya. And that's when the first diagnosis came.
Let me remind us something. The reason I saw we got tired is because the lump became too hard.
Okay.
and all of a sudden it popped out, so the skin
I
got
had a
torn.
wound.
And
Yeah.
we started getting uncomfortable when there was a bad stench started to come out, and the doctors are still telling us
This is mastitis.
Yeah, mastitis is giving us so many
Creams.
medication, antibiotics, until one day we visited the hospital in Nairobi, and they're like, you guys seek serious intervention and also check for cancer. That's how we landed in Aga Khan
Aga
Hospital,
Khan.
Okay.
and that's when it was diagnosed.
Oh, I see.
The
I
first
see.
diagnosis.
The first
The
diagnosis.
first diagnosis, yeah.
Just receiving that word, the term, the news that this is cancer. Take us back to that moment.
At that moment, there's something that when you're told about a diagnosis that comes to the patient, there's the way the caregivers and your friends and everyone else around you react.
True.
But you as the patient, at times you go blank. You go numb.
Okay.
You don't even think. But then for me that time, I'm like, at least now I know what you're dealing with.
dealing with.
Now we know what we can treat it with. But did we know how heavy that journey was? No. But I still had hope. Because during my biopsy, God gave me a song that it is so sweet to trust in Jesus, just to rest upon his word,
Yes.
just to lean upon his promise, and to know that says the Lord. That song carried me through. Even when I was being told, you have cancer,
Yeah.
you need to do chemo, you need to do radio, you need to do surgery, and it must be radical mastectomy. So that
Yeah.
means I'll be removed the full boob all the way to the armpit.
Yeah.
At that time, you just need a break.
Yeah.
When I had that, I told people, I don't want to talk to anyone for
Okay.
2 weeks.
Okay.
Let me understand what I've
what
just...
this all means.
what
Did
is
they
all this?
reveal at that point what stage it was?
Yes, it was stage 4.
Stage 4.
Yes,
Wow.
it was stage 4.
Yeah. Stage 4 cancer. What was that like for you?
You know, I'm a preacher. So I had just finished a very big conference somewhere in Eastlands. And Linda calls me because she went to collect the results alone. This was the first time ever since we married she went to the hospital alone. Every time she visited, hata kama ni kwenda kuangalia daktari kwa macho hivi, I was
You
there.
go together.
So I don't know what happened this day she went alone.
This day I insisted I go alone.
Yeah. And
Because
she
he was preaching.
Okay.
And so she called me and told me, I have been told I have cancer. It broke me. It hurt me. I questioned God so many times.
Yeah.
How I've been preaching and I've seen miracles happening.
Yes.
Why is the day I'm preaching is when I get to hear the
This
bad has happened to
news.
my house.
Yeah.
And also the imagination of the woman I love, Linda, has cancer, really pierced my heart so much. And for a while, I never prayed. I never looked into this God anymore. I felt betrayed by the heavens. And I think it was the least I expected. To this moment, that was the least I expected. But definitely having known what cancer is and having heard of how many people have died out of cancer, the journey of cancer, really stopped my thinking, and I felt like the world is coming to an end. It's a
Yeah.
bad idea.
Yeah.
And the reason why I agreed him to go alone is because I thought I'm going to be given another mastectomy diagnosis.
Okay.
There's another statistics that shows in Kenya, it's up to you go to the 6th or 7th doctor is when you get the right
The
diagnosis.
correct diagnosis.
Like for
Yes.
me, I'd gone to several hospitals. This was the 7th. So that you get that you
Wow.
have now breast cancer.
Yes.
Because when it started as a small lump, they were thinking it's just the milk. I mean,
It will
it's the
go
duct
away.
that
Yeah.
is swollen. So, yeah, that's why I allowed him to go and preach. Me, I go and pick because I just thought
Yes.
it's something.
Yes.
Yes.
Yeah.
And of course, I'm a man of God, so I knew nothing wrong.
I mean, no weapon
exactly.
fashioned
No
formed
weapon
against me
fashioned
shall
against us. The
prosper.
Lord has died for us.
Right?
Get behind me, Satan.
Yes.
Oh,
Yes.
Christians, we
But
need to get
this
that
thing
one off.
happened, and here we are.
And here
Yeah.
we are. That
I
was
mean,
the first one.
the first diagnosis.
Yes.
And Linda isn't, that was the first one. Just the second one?
Yes, there was a second one.
Okay. So still on the first one. So you told you have breast cancer, stage 4. What is it that you need to do? Like immediately. And at some point, because you said, I need a break. Okay, to just first of all digest and understand what this is all about. At what point did the information sort of like sink? That informs your next, step.
Did it really sink? Because that time, you're already in stage 4. So
Okay.
you've been rushed.
Yeah, there's no time.
Because there's a wound
There's no
that is
time.
already bleeding.
Mm.
So there's really no much time. It came to sink maybe later when I was doing now the radio, maybe almost a year or 6 months later.
Yes.
Because already when you're going through chemo, you also need to be strong to fight that chemo. Chemo is not easy.
Yes.
The chemo process is, it's horrible. Then again, you're going to lose a boob. That one also, you need to deal with that one on
Yes.
its own.
Yes.
You're going for surgery. You don't know if it will be successful. You don't know if they'll touch it, it will go somewhere else and such stuff. Then there's radiotherapy after
Yes. Yeah.
that. All those are heavy. They call them active treatment, but all really indulge you.
Yeah.
They make you. Then after that, there's hormonal therapy. There are those who go through hormonal therapy. Then you react to it. So by the time you're coming to accept that, then the
Yes.
second diagnosis came in.
Oh no.
So for me, even the way I deal with cancer, the breast cancer, it doesn't mean that because I have breast cancer and you have breast cancer and he has breast cancer, because even men get breast cancer, doesn't mean that we all go through the same treatment plan. Doesn't mean but we know the pain that you are going through. That's why we support each other.
I see that.
So you will find one starts with surgery, the other one goes straight to chemo, others start with radio. It depends with the type of the cancer. What is it feeding from? Is it hormonal positive? Is it a grade 2, grade 1, grade 3? There are many factors to look in by the time you decide that you're going through this. So you have to walk hand in hand with the oncology. Yes.
Winnie, let me help you. I'm very good with dates.
Okay.
Linda was diagnosed on the 21st of April,
All right.
2022. Do you know when Linda came to understand and get to the idea that she has cancer?
Okay.
The 19th of December, the same year.
Ah.
Yeah.
She was told she was diagnosed with cancer on the 22nd. And 2 weeks later.
Do you want to speak closer to your mic here so that we hear you? Yes, fantastic.
After 2 weeks, she's on. After 2 weeks, she's on chemo for 4 months.
Yeah.
After a month, she's on surgery. After a month, she's on radiation. So by the time she comes to understand what is happening, it's way far gone.
After.
And what happened is that we were at the doctor's office. That's when Linda says, "What's happening?" And the doctor asked me, "Why is she asking this way?" And we asked Linda, "What's happening?" And she said, "You mean I'm fighting cancer?"
Right.
That's when now we realized Linda it's dawned on her that there's cancer in our life, in our family.
Now, so can we just stick with that moment for a second?
Yes.
So you literally don't have time to process all these things. You, on the other hand, had so many questions.
Yes.
Okay.
Yes.
What did this do to your relationship at this point? Because again, we're looking at you, you're so much in love, right? But then there's this big news, that has come. What did that do to you? And you sort of like being forced to be her strength, because she has to go through all those things, the chemo, the radio, surgery, and all those things. Yeah. Can we? Yeah.
After the diagnosis was announced, the entire communication shifted to me. And that's when I realized that I sort of have become a prescription to her, like Panadol and other medication. It really took a toll on me, and I paused life and I said, this is a direction I was not going, and I'm forced to go to this direction. So what I did, I had to pause and ask myself, what do I do from here? What do we do from this moment onwards? Myself, what do I do? So as many people decide to run away and fear the moment, I looked at Linda from myself and I said, she's innocent. She's not called this for herself. And so I totally agreed with myself in a personal conference that I will be totally sold out for this journey. I zoomed to life and I picked the best out of the moment. Love, support, what she needs at the moment, and everything that was called for that moment. And I said, the best is to make a very radical decision to fight with her.
Fight with her.
Support her.
I like that.
Affirm her.
Yes.
Confirm her. And at the same time, tell her and also show her that this is still a season we are stepping into and we're going to get out of it. I had nothing else to do apart from being the man and the husband I had been before.
At the same time. I really like that. Linda, I also want to ask you the same in terms of seeing that kind of support that you're receiving. Did it help to make the journey a little bit easier? And I'm asking that question very carefully because, again, it's not an easy journey. You know, like you said, the pain and all those things. But just knowing at the back of your mind that you have this person who's strong together with you and for you. And what did this do to you as an individual? But I do not want to rush you because we literally have to go on a break. So we'll pick up from there on the conversation, and that is on this World Cancer Day, and under the theme, the new theme, and that is United by Unique Places, People at the Center of Care, and their stories at the heart of the conversation. We'll pick up from Linda, and also we'll be speaking to Mash, who is in Eldoret, as well as they're marking World Cancer Day over there. But the question that we're asking you this morning is very simple. In moments when you had lost hope, what was it that helped you to hold on? The question of the day again is, in moments when you had lost hope, what was it that helped you to hold on? To hope, I want to say. So engage with us on our socials at NTV Kenya, both on Facebook and on X, and tag me as well at Lubembe_Winnie. You want to call in live? Our numbers are officially open, and our WhatsApp number as well, 0112 500 400 is also open. Engage with us, and we'll see you on the other side of the break. Stay with us.
March 2025, we embrace the theme of marching forward. Here we stand as symbols of progress. Together, we march with confidence and grace, showing the world that when women rise, everyone rises. As the sun dips below the horizon, we transition from the greens to the glamour of the evening. We are inviting you, all the lovely ladies, to please join us at the Muthaiga Golf Club for a very unique experience.
In today's world, staying informed is more than just a choice. It's a necessity. Nation.Africa provides you with trusted, insightful, and engaging content to enjoy unlimited articles that go beyond the headlines. Visit Nation.Africa. Browse through the available articles and choose one that interests you. As you scroll down to read the article, you'll encounter a paywall message. To continue reading, please subscribe for full access. If you already have an account, log in using your credentials. If you're a new user, you can either create a new account by clicking register and providing your email address and other required details, or sign in with your Google ID for a quicker, hassle-free registration process. Select the subscription plan that best suits your needs and budget. Provide your payment details as prompted. You can choose between M-Pesa and card payment options. If you have a coupon or promo code, enter it in the designated field to receive a discount. Review your order details and confirm your payment. For M-Pesa, you'll be redirected to your mobile device to enter your PIN. Once your payment is successful, you'll receive a confirmation message. After completing the subscription process, you'll have immediate access to all content on Nation.Africa. Enjoy reading. Nation.Africa. Empower Africa.
I want my brother completely out of the family business.
Liam is the best fit for the company.
I think ini through personal mami tupatia.
Liam ayuko. Wacha kugakelele hapa. Utamsha madam.
All this is because of you. Now wake up. Wake up and clear your mess.
No, ma.
Want to know the biggest story of the week? Do not worry. The Weekly Review got you covered. for in-depth analysis of politics, business, governance, as well as social issues. The Weekly Review covers it all. For well-researched, exclusive and investigative content, read The Weekly Review every Sunday in the Sunday Nation.
Two cases. They had something.
Okay. All right. Now, here we are, over 30 minutes past the hour, and the show is Your World, just in case you're tuning in and thinking, Allah, what's happening? Okay. We are live from Karibu Inn, and the show will run all the way from 10 a.m. up until midday. And on this second hour of the conversation, we're focusing on the day, and that is World Cancer Day 2025, under the new theme that will run from 2025 all the way to 2027. And the theme is United by Unique Places, People at the Center of Care, and their stories at the center of conversation. But listen to this. Before we speak to Marsh, who is in Eldoret, to help us understand what the day means, what are the gaps that we have experienced, and what needs to be done, we are, like I said, at Karibu Inn, where they have high-impact conference facilities and team building. If you're looking for luxurious accommodations, versatile event spaces for celebrations, like I said, Valentine is coming, okay? Picturesque grounds and romantic proposal setting with a kissing bridge somewhere in the vicinity. Okay, so if you're looking for a space to treat your loved one, Karibu Inn is where you need to go. But for now, let's cross all the way to Eldoret. Marsh, it's good to speak with you this morning. Kindly tell us where you are at on the day and the event, and what exactly this day brings.
Well, it's a good morning, Winnie, and indeed it's also a good day on our side, as all medics and all staffs of Moi Teaching and Referral Hospitals, not just them, but all hospitals, are joining together today to create awareness through a campaign on the World Cancer Day. Indeed, we're joining millions of Kenya globally, millions of Kenyans and millions of people globally to just create awareness in terms of cancer awareness. But right here, I'm joined with one Dr. Kioko, who is a clinical oncologist from the Eldoret Oncologist Associates, actually. And we would really wish, Doctor, for you to tell us this year's theme. You've said it is
United by Unique.
United by Unique. Yes. Why that theme?
So, United by Unique was inspired by multidisciplinary teamwork, because now when it comes to cancer, it is not a one-man thing. And these patients actually start at the primary level, they are diagnosed, and then they rise until they get the best care from oncologists and oncology centers. So this theme is to bring the connect between all these departments and to treat a patient not as a cancer patient, but as a person. So this theme was truly inspired by the connect between all these departments. Yes.
Well, indeed, Dr. Just to delve to the bigger question, we are talking about cancer. Probably you can tell us the common types of cancer. Also, probably tell us, are they regional based? What is the age gap expectation about cancer? Today, I happen to have interacted with an article from the Daily Nation, and they were talking about that your cancer is decided even before you are born. I think you get the meaning better. Probably you can mention what are the common types of cancer. What is it regional based? Is it decided by age gaps?
So we have basic cancers which we usually diagnose on a day-to-day basis, which are breast cancer, we have cervical cancer, we have prostate cancer, and these are the numbers, the cases we get in high numbers. So, and the other question that you asked previously concerning the article that you saw, it is basically issues to do with genetic mutations, and it's a bit tricky because now it is basically enhancing issues to do with screening. So if you get screened early, now if there's a family history and you get screened early, we usually diagnose these things early and get the best treatment from the best cancer centers.
In terms of mentioning, in terms of screening, talk about screening. Where are we as a country, Kenya, in terms of numbers, in terms of diagnosis of cancer patients?
So issues with the numbers have been rising simply because diagnostic measures have increased and people have been started being aware of cancer and then seeking screening at an early stage. So that is the reason as to why numbers have been rising, because of the diagnostic measures and the awareness, increase in awareness.
The basic point of diagnosis definitely is self-diagnosis. So what can you say should be the early symptoms for anyone there back at home to do the self-diagnosis and probably show the need to go for screening to look for any signs of cancer?
So we will start with mentioning a few cancers. Like breast cancer, you will find something weird or something different on your breast, like a lump. That is for breast cancer. So you are supposed to seek care from your basic primary clinic. And then for cervical cancer, basically you will experience different flows of your cycle. This is for ladies. You will experience maybe excessive bleeding. So with this and irregular bleeding, you're supposed to seek best care from your clinics.
So definitely you're talking about diagnosis, and as much as many people are showing diagnosis and early detection of cancer being a key factor in terms of prevention and treatment of cancer, not really prevention, but treatment of cancer, early treatment. So can you just tell us what are some of these bigger things that in terms of what are the problems you're facing in the oncology world in terms of people? Do people show up for these screenings? Are people comfortable with this screening, etc.?
So the reason as to why we are gathering here is because now we want to improve and increase the awareness, because there's stigmatization, there's still stigmatization, and when a person starts experiencing different changes in their bodies, they fear that they are going to be judged, they fear that people are going to think different of them. So we are gathering here today so that we can encourage people to seek screening and to stop stigmatization, because cancer can be cured, and with the early diagnosis there is a chance of 100% cure. So today that is our theme, is to create awareness through creating a connect through all these departments so that we can help increase diagnosis and awareness.
Just talking about people showing up in terms of stigmatization, definitely there's the bigger question in terms of there's the myths and misconceptions around cancer and probably the diagnosis of cancer and the societal perspective about cancer as a disease. So what would you say are some of the myths and misconceptions we are hearing out there? Separate them from the facts about cancer.
Mm-hmm. So some of the myths are that when a person is diagnosed with cancer, they can transmit it through contact. Those are some of the myths, and it has really affected treatment, because now these patients are isolated and stigmatized even by their primary, even their first relatives. So it really interferes with treatment, because these patients can be at stage 1 at diagnosis, then they just disappear, and then you find them at stage 4 because of the stigma and the isolation from their caregivers. So we really encourage people to get the correct information so that now we can handle this case together. And another myth is that cancer cannot be treated. And when you get cancer, that is a death statement. And as we've stated previously, cancer can be treated. If you get diagnosed early, you can get up to 100% cure if you are diagnosed early. So this is the theme of today: create awareness, spread information so that people can be aware and know the facts.
So while you're talking about stages of cancer, does it mean all stages of cancer are treatable?
We will not say that, but early stages can be treated. Stage 4 can also be managed, and that is not a death statement or a death sentence. So we encourage people to seek screening, even if it's a later stage, we can manage, and we can make sure to improve. We can make sure that we improve the quality of life, and by focusing on initiatives that encourage improvement of quality of life, handling a patient as a person and not just as a patient, and that is by also psychological care, nutrition care, and improving the quality of life generally.
Dr. I will have to ask you this. What you don't know won't kill you. Is it a misconception or is it a fact? What would you say to such a patient or somebody who is suspicious of the early signs and definitely believes in what I don't know won't kill me?
That is a myth. That is a misconception. So I will say that if you delay, things will move and will move quick. So when you seek care at an early stage, when you detect something, they usually say that fools live long. So when you detect something in your body, you're supposed to seek care. You're not supposed to assume that this thing is not going to kill you or it's not going to interfere with your normal daily life. So we encourage that when you get something weird or something strange in your body, seek care, seek expertise care, and you will get the best care.
So maybe lastly, we can talk about the Eldoret Oncology Associates. Why have all medics in terms of cancer treatment come together, different hospitals coming all along? Why would they have to link up? What is the necessity for you guys coming together, despite coming from different treatment centers? Why link up together to fight this disease called cancer?
That is because now most of the facilities around deal with different conditions, and you will not discriminate or say that this patient will directly go to an oncology center, that is a cancer center. Most of the patients are diagnosed in different facilities, which are not special facilities. So when they are diagnosed, we want to create that connect so that this patient can be maneuvered faster and in time, so that they can get the best care early and get a good outcome.
Definitely we will not leave this discussion, Doctor, without discussing the whole issue about insurance. Probably there's the introduction of the Social Health Authority insurance. Can you tell us, does this as a basic Mwananchi cover, does this cover cancer treatment different from NHIF? What are some of the changes that have been incurred in terms of the NHIF SHA transition?
Okay, I'd say everything has its positive and its negatives, but so far so good. We've seen huge numbers of registrations, and the good thing about SHA, it has encouraged screening. So it has catered for the cost of screening so that people can seek screening. And that is the best way to handle this thing, because we have two ways when it comes to cancer. We have cancer the fear, we have cancer the disease. And if we handle cancer the fear, we will manage to win this battle against cancer the disease.
Thank you so much, Dr. But just a parting shot to the common Mwananchi as you are creating awareness today in terms of Cancer Awareness Day to Kenyans. What is your parting shot?
Oh, my parting shot is, if we don't fight the fear, we won't win the battle.
Thank you so much. Well, that is Dr. Kioko from the Eldoret Oncology Associates. You've heard it, Winnie. Well, it's a unity in terms of medics coming together to just bring out the fight against cancer and its treatment. And also just to note, today there's a bigger celebration. Earlier on, I've followed a group of medics who have taken a walk through town to create awareness, as launched by the CEO of the Moi Teaching and Referral Hospital. While we are still pitching camp here to see the unfold of the day, the new message for the Mwananchi in terms of cancer awareness. But for now, Winnie, back to you and your panel.
Thank you very much. Really appreciate that. And of course, what a way to really emphasize on the importance of not just focusing on the treatment, but also really awareness, and our attitudes as well towards cancer. And like I said, today is Relationship Tuesday, and cancer must bow. That is what my guests are saying today on set. Linda, and also Dr. mentioned the importance of early diagnosis. And you also mentioned the same, that in the country there's a very big gap when it comes to getting the actual diagnosis. And sometimes by the time someone gets their diagnosis, almost always too late. But emphasizing really how important it is for people generally to seek care, yes, but at the same time have the healthcare providers give timely diagnosis, right? So 2022 is when you got your first diagnosis, went through treatment, various forms of treatment and surgery, a 6-hour 6-hour mastectomy.
Yeah.
That was wow. And these, again, like you said, drained you in so many ways.
Yes.
Do you want to take us through what that was?
It can, okay, the diagnosis, also the whole treatment plan drain you.
Yeah.
Physically.
Yes.
Emotionally, spiritually, financially. I think I should go back to now financially again, because cancer treatment in Kenya is quite expensive. And you getting good quality services, it's really hard to get at a cheaper rate. I like what the Eldoret team are doing, where the oncologists are coming as one team, so that when they see something, when something comes up, they can now discuss over that case, which is a good thing.
Yeah.
But now when it comes to these other expenses, and at times even the insurances, they'll not take you another round. You can be dropped off by the insurance that you've been paying maybe for 10 years for your own health insurance.
Okay.
Then they see it is expensive. Most of the cancer patients, you find them paying cash. Because now it gets to a place when you've applied maybe the NHIF or SHAD, there's a certain limit you have.
Yeah.
And for me, I had 8 cycles of the chemotherapy, but NHIF covered up to 6.
Okay. And one cycle is how much? Again, I know this varies from facility to facility.
It varies
right?
from facility to facility, and also the type of chemo you're getting.
Okay.
So for me, it was around 100. The first one I saw, the first bill I saw was 120K. The rest I've not been allowed to see. He was the one. It's a good support system.
Yes.
I was not seeing the numbers, because when I start seeing the numbers, now you start thinking, where am I getting the I need to concentrate on healing.
Healing, yes.
Because the side effects of the chemo, it drains you physically. Even your immune system just goes down. Homa feels more worse than COVID. It's so for me, I like that he was my primary caregiver. I had other caregivers around me, the nurses and everyone, but he was the decision maker.
Yes.
And I loved it because he was also knowing me as a friend, and he also knows me as me.
Yes.
Because even this first diagnosis, for it to have happened, he's the one who said, Linda, you're not okay.
Yeah.
He's the one who called it out.
Yes.
So it's good to have caregivers. It's also good to you have people who talk good things to you.
Yes.
Even let's say you visiting a patient or being around a patient does not mean you're the caregiver. Let me put that across.
Yes.
Doesn't mean you're the caregiver. So whatever you're telling that person, is it building them? Is it bringing them down? So it's all round. It's all round, including what are people saying to you?
Yes.
How is your mental state? How is your emotional state? Cancer affects you as a whole person. That's how I see it.
Yeah.
It affects you as a whole person. It doesn't live at he pale, this there. No, it's you as a whole.
I see that.
Yeah.
I see that. And support system. And strong support system at that. Not just support system.
Not just any.
Just any word. You know, just being there, coming to see you. Hi. No, you need a very, very strong support system.
Sober.
Yes.
Support system.
Yes. So surgery happened, right? And at this point, you know, okay, fine. We're okay. We're doing well. Okay. We crossed that bridge. And then 2024, September.
2024.
2024. What happened?
I was thinking I was reacting to the hormonal therapy. I was on a different hormonal therapy than the one I'm right now. So I had a headache that was not going, and it wasn't filling the drugs. I'll go for injections. It's not working. My oncologist insisted on admission, and we need to do an MRI. Let's just see what is in the brain. This headache that's not going.
Yeah.
And that's the time we had the second diagnosis.
Oh no.
There was a recurrence in the brain.
Brain.
Yes.
Just a minute.
Yeah.
Let me take you back to early 2024.
Okay.
Linda started having a very serious agitation. She really felt like bad every day.
Yeah.
Having very weird headaches, migraines, too many complaints. And we started feeling like she's not okay.
Okay.
Again, the same thing happened. Misdiagnosis.
Okay.
Because we'd go to our nearby hospital and she's given painkiller, Panadol, and to some extent, none of them worked. Until this evening, the 6th of September, is when he said, it was actually around 9 p.m.
Okay.
Why? No, the 4th of September, we went to a nearby hospital, actually a branch of Aga Khan near us. And the doctor looked at us and said, we need to see a neurosurgeon. So the 6th of September is when we said, this thing is getting worse, because even the medication we got from the branch did not work.
Responding.
So when we went to Aga Khan Main, is when they said, let's do an MRI and ascertain exactly what is happening.
Yeah.
Only for them to see something big in the brain.
So what does that do to you? Because you see, at one point you think, you know what? We got this diagnosis. We've gone through the treatment. We're okay. She's feeling better. I want to believe at this point you're feeling much, much better.
Yeah.
And then all of a sudden you're told, there's a tumor. And it's cancerous, right? What does that do to you, Linda?
Wow.
And Felix will also come to you, yeah.
At that time, even before, we were doing, I also went to, there's a part he didn't say, I also went to a place to do something to do with the mental health. I was admitted. So now they're thinking, maybe I didn't accept I had cancer. Now I'm psychologically unfit. I need to do counseling and all that stuff. We did all that. It wasn't the reason. The reason was this diagnosis.
Yeah.
And this diagnosis, at that time you're being told you're having cancer again, doesn't mean that throughout the 2 years, there's nothing that was being done.
Yes.
We were doing tests.
Yes.
We were doing everything. I had done PET scan. In October, I had done another MRI. It's not that it's just...
You were just told,
at pause life, I'm not doing tests. Everything came back clean. My tumor markers, I didn't have cancer. Yet, I had a tumor in my brain. That time I really didn't have, with the breast we had even to look for a second opinion, third opinion, even you do researches. Are the other doctors in line with this?